what I'd like to show you now is how the guidelines work. And as you can see at the top of the encounter, that we have a yellow alert, and that this is a dashboard showing that there are 14 unmet wellness guidelines and 5 unmet disease management guidelines that the patient does not qualify for a clinical trial. We'll pop open the guideline wizard, and you'll see that the unmet guidelines are in yellow, and it's actually a fairly simple procedure to do a guideline. We'll just order the test like that, and we'll show that that goes into the assessment and plan. We'll order a test. There are 4 major things you can do: is show that it's not applicable, order, which we showed already, do a future order, and show that it's been done already. In this case, we'll just say he had his colon removed, so he can't have a colonoscopy. And then that basically shows, in fact, that the guideline's been met now. And this is a nice way for physicians to show that the guidelines shouldn't be applied to a certain patient, and allows really for more fairer and sophisticated audits on a practice, given the fact that you can determine, A, whether a patient's compliant or not, because we have the status of the order here, and B, whether the patient should be applied to a certain guideline, as in this case here. Just to kind of follow this through, we'll, for some reason, and he's going away or whatever, we'll order, just to show you how this works, the PSA in a year, and we'll just say his cholesterol was done already a month ago. And so that will make that guideline appear as being met. Now, for vaccines, it works a little differently. This person needs to have both a diphtheria, tetanus, and pertussis, and we can in fact order all 3. And when we do, those orders are made as well. Now, you see with the flu, because it's not flu season during the demonstration, he does not need a flu shot. But were this to go through the flu season, then in fact it would be alerted that he needs a flu shot. And then basically the disease management guidelines work exactly the same way as he had before, as you saw above with the wellness guidelines. Now, in this case, we have disease management medication guidelines, and basically it determines whether a patient is on the appropriate medication for his diseases and comorbidities. And because this person's on lipid medications and hypertensive medications, in this case ACE, he's met his guidelines and they're all met. So when we close the window, we see that the orders made in the guideline wizard are seen here. And when we sign them, they will go into the inbox, and we'll just do that now. Now, when we go into the inbox, I went in as a physician, so the filter is set just really for encounters and histories, because that's, as a physician, all I care about. But we can change the settings, and if your office staff would have, when they would go in, it would be set at these settings. And we'll just change the settings so we can see, in fact, what has been placed. And to make it a little easier, we'll go into demo full, and we said these are the orders that we wrote on the patient. Now, what we can do is we'll just complete a couple of them, and then we'll go back to the guidelines and see, in fact, that, and we'll do the DPT, that the guidelines are met with this. And we'll just do one more of the lipid panel. In fact, we'd be going through the whole list. We would just be, once the order was placed, we'd be waiting for the result. If it was going out for a lab test, a completed order for a vaccination would be done right at the office. But we'll just complete them now just for demonstration purposes. We'll go back into that patient, and we'll see that those guidelines are met. Not only can you call up an encounter from the inbox, you can just call in a patient from the encounter search. And that's what I did just there. And we're loading now. And you see the number is down, and that's because we met. That was a completed order. I think the cholesterol, we said that was done already. The diphtheria, tetanus, and pertussis were completed orders as well. So you see that the guidelines change when you complete the orders. So here we have a way for point of care entry of guidelines, and these guidelines can be edited, created by the practice, and they're reviewed in every patient when they come in for an encounter, but looks at both their demographics and their diseases.